Hello everyone, I am Dr. Abhinaya Alluri, consultant obstetrician, gynecologist and laparoscopic surgeon at Care Hospitals, High Tech City. Today, let's talk about UTI or urinary tract infection. Ma'am, today I went to the washroom and I had severe burning while passing urine. This is how most of the patients come to us. They even tell us that the burning is so severe and they couldn't stop crying. Now, what is the cause of all of this? This is nothing but a urinary tract infection. Any infection to the kidneys, ureter, urinary bladder and urethra is called a urinary tract infection. And did you know? UTIs are more common in women than men. This is because of the short length of the urethra, that it's only 4 centimeters in women, and also less distance between the anus and urethra. Now, what causes a urinary tract infection? So, it is mostly caused by bacteria, and E. coli is the most common causative organism. Now, what are the risk factors or what behavior increases the risk of UTI? So, during sexual intercourse, there is a chance of the bacteria which resides around the anus to come closer to the urethra and then nidus in the infection in the bladder. And also, if you are using any contraceptive measures like diaphragms or spermicidal agents, they can increase the chance of UTIs. And if you are diabetic or recently had a UTI or had prolonged catheter use for a long time, all this can increase your chances of having a urinary tract infection. And not to forget postmenopausal women, that is in people whose periods have already stopped because of there is lack of estrogen. This can change the pH of the vagina and also increase your chances of having a urinary tract infection. Now, any infection that's confined to only the bladder is called the cystitis, and if the infection ascends up and the kidney is also involved, it is called pyelonephritis. Now, how do we differentiate between cystitis and pyelonephritis? So, in simple cystitis, as we already told, the people mainly complain of severe burning sensation while passing urine, or they can also have pelvic discomfort, lower abdominal pain and suprapubic tenderness. If the infection has spread to the kidneys, then it can cause high-grade fever with chills, nausea and vomiting and flank pain, and this should not be neglected. So these are the common symptoms how patients present when they have a urinary tract infection. Now, how does your doctor identify that it's a urinary tract infection? It's mostly a clinical diagnosis, and also your doctor may order some complete urine examination and urine culture to confirm the infection and also find the appropriate antibiotic. Now, coming to the most important thing. How can you prevent a urinary tract infection? So, as you have seen the risk factors, changing this or modifying this behavior can decrease the chance of you having an UTI. So, what are the simple lifestyle measures you can follow? So, please drink plenty of water. Now, how much water? At least 1.5 to 2 liters per day. This helps in flushing out the bacteria from your bladder and doesn't allow the infection to stay there. And whenever you have intercourse, please get up and pass urine forcefully and never hold urine for long duration of time. So these simple measures, by following this, you can decrease your chance of having UTI. And if you are diabetic, make sure your sugars are under control. And if you are postmenopausal woman and you are having recurrent urinary tract infections, please meet your gynec so that they can examine you and can advise estrogen cream if it is needed. And what are the prevention of urinary tract infection is not complete without the mention of what is called cranberry. So we all know that cranberry has been popularized as one of the best preventive methods to prevent UTI. So do they really work? Do the cranberry supplements work? So there is no substantial evidence to say that, but some studies have stated that cranberry helps in preventing UTIs. This doesn't allow the UTI bacteria to stick onto the walls of the bladder and thus decreases the chances of having a urinary tract infections. So this is a simple measures you can follow to prevent yourself from having a urinary tract infection. But make sure if you have any of these symptoms, please meet your doctor so that they can treat you appropriately. Because if you don't get your infection treated, it can become recurrent and it can cause permanent damage to the kidney, and sometimes it can also lead to sepsis, which can be life-threatening. So please be aware, please drink lot of water and prevent yourself from having a UTI. Thank you.